and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Link between socioeconomic disparities and brain health in aging and dementia study finds. A research paper is published in Nature Aging by an international team of researchers from the multi-partner consortium reveals a direct link between structural inequalities such as socioeconomic disparities measured by a country-level index and changes in brain structure and connectivity associated with aging and dementia. Key findings from the research are: number 1, researchers found that higher levels of inequality are linked to reduced brain volume and disrupted connectivity, especially in temporoposterior and cerebellar regions, essential for memory and cognitive function. Number 2, the findings also revealed that Latinos with Alzheimer's disease experience the most severe impacts, suggesting that environmental demands linked to structural inequality may exacerbate neurodegeneration in aging population. In contrast, the milder effects observed in frontotemporal lobar degeneration support the hypothesis of a more significant genetic influence in this condition. Reduced brain volume and connectivity are frequently observed in patients with dementia and are associated with disease progression and severity. Number 3, notably, associations persisted even after accounting for individual factors such as education, age, sex, and cognitive ability, underscoring the independent role of macro-level factors in shaping brain health. Living in a context of aggregate inequality affects brain health regardless of your specific socioeconomic level, demonstrating the far-reaching consequences of societal disparity on the brain. Researchers analyze impact of MS drugs on pregnant women and their babies. An analysis of over 3,700 pregnancies of women with multiple sclerosis indicate that therapy doesn't lead to increased risk of miscarriage, premature birth, or serious birth defects. A research team headed by Professor Kerstin Hellwig from the Department of Neurology at Ruhr University Bochum, Germany, analyzed over 3,700 pregnancies of women with multiple sclerosis. More than 2,800 of them were treated with different immunomodulating agents before or during pregnancy. The researchers published their findings in the Lancet Regional Health Europe. The data from the pregnancies included in the study came from the German Multiple Sclerosis and Pregnancy Registry and was collected between November 2006 and June 2023. 2885 pregnancies were analyzed, during which the mothers had received a so-called disease-modifying therapy. The substances used in the study included interferons, glatiramer actate, dimethyl fumarate, teriflunomide, S1P modulators, alemtuzumab, natalizumab, anti-CD20 antibodies, and cladribine. 837 pregnant women had not received any medication for multiple sclerosis. Can dancing lower depression associated with Parkinson's disease? Dancing lowers the depression associated with Parkinson's disease, and the benefits can be seen in multiple ways. A new study published in the Journal of Medical Internet Research involving York University researchers shows. The study followed 23 participants in the Sharing Dance Parkinson's program at Canada's National Ballet School who had a diagnosis of Parkinson's disease, as well as 11 healthy controls who were mostly family members or caretakers of those with Parkinson's disease. The participants took weekly dance classes for 8 months, which progressed from simple leg and footwork and piles to interpretive movements, waltzes, and more complicated choreographed dances. The researchers honed in on a node in the brain, the subcallosal cingulate gyrus, that has been shown in previous research to be implicated in depression. They measured mood and depression scores in all participants using a geriatric depression scale before and after every class and conducted regular MRI scans at York. UC Davis Cardiologist implants first dual-chamber leadless pacemaker in a child. UC Davis Director of Pediatric Electrophysiology Dan Cortez is the first to implant a dual-chamber leadless pacemaker in a child. The case report was published in the journal PACE, Pacing and Clinical Electrophysiology. A 13-year-old patient was referred to the UC Davis Pediatric Electrophysiology Clinic for pre-syncope, a feeling of lightheadedness or dizziness without actually fainting, after being monitored for years for congenital complete heart block. Pacemakers are typically placed in children with congenital complete heart block, a rare condition that can lead to sudden death and affects 1 in about 15,000 to 22,000 children. After serial electrocardiograms and Holter monitors showed progressively lower average heart rates, Cortez talked with the patient and their families about pacemaker options. Dual-chamber leadless pacemakers help regulate the heart's rhythm by stimulating the heart's upper and lower chambers. Because the patient wanted to remain active in sports without restrictions, leadless pacing was presented as an option and the family agreed. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.